And welcome back. Right now, 9:17. More than half of the 27 million Americans affected by thyroid disease have never been diagnosed. January is National Thyroid Awareness Month, and an opportunity for us to learn what it is and what problems it can cause and how it can be diagnosed. We're joined by Dr. Brent Wallis of People's Health. And first of all, Doc, we appreciate you being with us. Let's talk about what is the thyroid and what is the function of the thyroid?
Sure. So the thyroid is a gland that a lot of people may not know about, but it actually sits low on your neck. It's bow tie shaped, and it has an incredibly important function. It actually produces thyroid hormone. That thyroid hormone is really responsible for our metabolism, and the metabolism is really how we create energy and use the food that we eat. So it controls a lot of different systems throughout the body.
So if people have thyroid issues, what are some of the symptoms that we have to look forward to? And with that, when do you say, you know what, I really need to get this checked? So some people may have symptoms and they say, it's not a big deal. But when do you get to the point where you really need to get tested?
Sure. So there's really two different situations that we see. We either see a hyperactive thyroid or a hypoactive thyroid. So hyperthyroidism is where the thyroid is really overactive and producing too much hormone. That hormone can lead to a lot of symptoms like anxiety and fatigue, stomach upset, sometimes even diarrhea or loose stool, and weight loss. And then in particular, sometimes we'll see an intolerance to heat and a lot of sweating. Hypothyroidism is really the opposite of all that. So you tend to see some sluggishness, some decreased energy, constipation, and then weight gain. So what's really it's really difficult sometimes to tease those out because those symptoms can be caused by a lot of different diseases. And so sometimes people don't recognize it as being thyroid related. So if you are having any of those, it's really important to speak to your doctor about them.
So if you are diagnosed with any of these diseases, what is the effective rate of different medications to actually control it? And is there a cure for it?
Yeah, there definitely is. It's actually relatively easy to identify with a blood test. And once we identify that, and we know whether you're hyperactive or hypoactive, then we can treat you usually with medications. In rare instances with hyperthyroidism in particular, sometimes we do have to remove the gland, so there may be surgery required, and then we'd have to supplement the thyroid hormone afterwards. But the treatments are extremely effective. That's why it's important to recognize it early.
So with the pandemic, we were talking off camera just before we went on the air, you know, a lot of people are still really skeptical about going into a doctor's office, but this is a blood test, and you really would have to get out and get that blood drawn. Is that right?
Exactly. You know, this is not something that can really be screened effectively over telemedicine, but you can discuss the symptoms with your physician, perhaps via telemedicine, and they may recommend that you go to a lab to have that blood test done. But the blood test is very quick, simple, comes back in about a day, and really gives us a lot of information.
All right, doctor, thank you very much. We appreciate that. National Thyroid Month is January, and of course, any of those symptoms, you may want to just call the doc, and hopefully you'll get through it. And medicines. Thank goodness for medicines today, doctor, because they really make people's lives a lot easier.
Definitely.
All right, thank you very much.